There is another problem that many patients with Parkinson's disease may have, which are complaints related to the gastrointestinal function. Some of these complaints can be a sensation of the stomach being full too early. One of the most frequent complaints is constipation. And constipation has two components to it. One component is the fact that the patient has bowel movements in an infrequent way. Probably it be something like 3 to 4 days before having a bowel movement. The other issue has to do with the difficulty in actually emptying the bowel. It becomes hard to empty the bowel, and in part it's related to a hardness of the stools. Now, one would have to ask, what are the strategies a patient can follow in order to deal with these difficulties? And I believe they're very important because they affect the quality of life of a person. One of the main patient education issues is that the management of constipation is not any different for a patient with Parkinson as compared to somebody who does not have Parkinson. So these are standard recommendations. They promote physical exercise. So the more active you are, the more you will have success in improving the situation. The other issue has to do with the consumption of liquids. So consumption of generous amounts of liquids throughout the day, unless there is a medical reason not to do that, would also be highly advisable. And then there is the issue of diet. And information on high-fiber diet is readily available. And it will include, of course, such things as a lot of high-fiber cereal or green vegetables. Other than that, there are a number of over-the-counter medications based on psyllium, P-S-Y-L-L-I-U-M. Some of the brand names are, for example, Metamucil or Per Diem. And those taken in a regular fashion should be viewed as a natural way to deal with this problem. There is also one additional strategy that you should be aware with regards to urological dysfunction in Parkinson's disease. It is that in severe cases that have not gotten relief with the usual medications and where the urologist has not found any surgical correctable problem, such as an enlarged prostate, that botulinum toxin type A, one of the brand names is Botox, can be used successfully, or at least it has been shown to be successful in trials for this symptom. Now, this is a more involved process because, again, it has to be done by a urologist who performs a cystoscopy and then through the cystoscopy injects this product. And the urologist, of course, has to be trained in this technique. So be aware that this treatment is available.